Breast cancer is now the most fatal cancer amongst women worldwide, and it's the same here. But the problem in India is that it's often not spotted early enough, with more than 60% of the women diagnosed here at stages 3 or 4. I've come to the Cama Albless Women's and Children's Hospital in Mumbai to find out why, and also to see something new, a low-cost device that could aid early breast cancer detection.
Most of the women, they don't go for a mammography thinking that it is very painful. In a developed countries, if the women they are coming in early stages, that's why they are getting treated, and their 5-year survival rate is 80%. But if you see for the developing countries, most of the Asian countries, if you look even in the China also, they are coming in advanced stages. In advanced stages, there is a very limitation of role to treat them, either surgically, radiotherapy or chemotherapy. And in that case, the 5-year survival rate will be less one.
Mammogram devices are, of course, also expensive, and taking one, plus a skilled operator, to remote areas is impractical. Dr. Katke's hospital is one of those using eye breast exam, which works in a very different way. Instead of using X-rays, like mammograms do, it has 16 sensors which vibrate and collect pressure data as it's moved around the breast. Any tumours, which are stiffer than normal tissue, will register on the accompanying app, and any areas of concern can then be referred for further examination. It's this portability that grabbed the attention of the Minister for Medical Education, who's helped to fund the eye breast exam programme.
On
the government level, we have installed these machines in all the medical colleges for women to come and get checked for breast cancer from various parts of the state. We also plan to send this machine to other places like civil hospitals and medical colleges. With this machine, we have been carrying out screenings in villages, townships and cities, and plan to cover the whole of the state of Maharashtra. The ones who are affected are to be brought to Mumbai and Pune, thus saving many lives.
So this is the device, and what surprised me is how gentle it feels. So these are tiny vibrations that it's giving out. That gentle vibration is all that's needed to detect lesions as small as 3 millimeters, and that's far better than the 3 centimeter lesions present in late-stage breast cancer. And achieving that level of accuracy has been the real innovation here.
It's a tiny sensor that, when given a little bit of power, can create these micropalpations on the breast. And inherently, that's why it's different than mammograms, which uses X-rays.
But is this better than mammography?
I think we have long ways to prove that it is better than mammography. We are not there yet. It is already creating access where mammography is not able to reach. So in that sense, there is no competition between the two modalities. Eye breast exam helps provide pre-screening and identifies women that are at risk. And then mammography could really provide a diagnostic affirmative answer whether that woman needs to be moved upwards or not. And our goal is to really help provide this as a standard of care solution to all the developing countries that are struggling in the same way.
And that's it for Click in India, for the moment at least. We've had an absolutely fascinating time here, and you can see plenty more photos that we've taken around and about the place on Twitter at BBC Click. Thanks for watching. We'll see you soon.